Hi, I'm Bryce. I'll be your physical therapist today.
Helga.
Nice to meet you, Helga. So before we get started, if you would, just confirm for me your name and your age, please.
I'm Helga, drink wine, and I'm 24.
Perfect. Um, so what's bringing you in for physical therapy today?
Well, a few weeks ago, I was stepping up on this pot to hang some flowers, and when I went to come down, my dog was in the way, and my leg, there's just a shooting pain when I landed. It was more like sharp, not really shooting, but
Okay.
yeah,
Okay. And you said it happened a few weeks ago. Do you
yeah.
remember exactly when?
It was about 4 weeks ago.
Okay, 4 weeks ago.
Yeah.
Okay. Um, what do you do for a living?
I am a dancer at SeaWorld. I wear the chipmunk costume. I don't know if you've ever
Of
seen it, but
course.
yeah, that's usually me.
Nice.
I've been promoted to trainer though, so
Oh, very cool.
I get to train the new dancers.
Very cool. The leg pain probably messes you up at work a little bit, huh?
Yes.
Yeah.
I've still been kind of trying to go. I can't go as much,
Okay.
but sometimes I sit and try to direct them. But occasionally I have to stand and show them something, and it can get pretty bad.
All right. Well, we're gonna work together. We're gonna make that better.
Okay.
What other kinds of exercise and hobbies do you do?
Well, I like to run. I actually recently started running, which I cannot do anymore.
Okay.
And I have a dog. I like to play with my dog,
Okay. What's your dog's name?
Toby.
Toby. Very nice. I have two dogs too.
Oh, really?
Yeah. Yeah. Mariah and Jasmine.
Aw,
Yeah. Yeah.
love
So
dogs.
me too. Me too. I'm a fan. Um, so what? So with your leg pain, is there pain anywhere else in the body?
No,
No. Okay. What? So how high up your leg does your pain go?
probably just about right here.
Okay.
I guess.
And how far down does your leg pain go?
Probably like right before the knee.
Okay. Okay. So kind of pretty isolated back there.
Yeah.
Okay. Um, so I drew it here on the chart. Does that look like your pain?
Yeah.
Okay. Perfect. Perfect. And how would you describe your pain? You said it was more sharp when it first happened.
Yeah.
What about now?
Um, it's sore, really
Okay.
sore and tender. Um, kind of achy, I guess.
Okay. Okay. Kind of achy. Okay. Um, and then right now, on a scale of 0 being no pain, 10 being like extreme pain, take me to the emergency room. Where would you rate your pain?
Right now it's probably just at a 1.
Okay.
It doesn't hurt that bad. I've been
Okay.
sitting down most of the day.
Okay. So sitting down is not too bad.
Yeah.
Okay. Um, at when your pain is the worst on that same scale, 0 being no pain, 10 being emergency room pain, where would you rate your pain?
Probably about a 6.
Okay, so 6 at its worst.
Yeah.
Okay. And then when your pain's the best, or when you have the least amount of pain.
Um, I don't really have it all the time,
Okay.
so I guess sometimes it's 0.
Okay. Okay. That's good. Okay. So talking more about your pain, what kind of activities do you have to do to aggravate your leg?
Um, Even just walking, if I walk for more than 2 minutes, it can hurt pretty bad.
Okay.
Um, and I can't dance at all
Okay.
now, so because
Right.
that would just be way too painful.
Right. Okay. Um, do so when you're dancing or when you're walking, how high up does your pain get on that 0 to 10 scale?
It can go up to a 6 if I walk long enough.
Okay. How long do you have to walk?
Probably 2 to 3 minutes. Yeah.
Okay. And then what about when you dance?
Uh, just starting, it,
Okay.
it can shoot up to
So
the
so
6.
really
Yeah,
fast.
it doesn't take very long when I'm
Okay.
dancing.
And when it's kind of at that 6 out of 10, does it go anywhere else in your body, or does it stay right on that back of the leg?
It stays right there.
Okay. Okay. Um, so when you do find yourself in a lot of pain, what kind of activities do you do to relax that pain?
Well, the doctor just told me to put ice on it and rest, so
Okay.
that's what I've been doing. It
Yeah.
works pretty well. I mean, I can get it down to a 0 where I don't have any pain.
Okay. Good. How long does it take to get down to a 0?
Probably like 10 minutes.
Okay. 10 minutes.
Hmm.
Okay. Perfect. So I just want to know a little bit more about how your leg feels throughout the day. So when you wake up in the morning, how does it feel?
Pretty stiff. Um, after I get moving around, maybe after an hour or so, it kind of
Okay, so
it's
after an
not as
hour.
stiff. Yeah.
Okay. And then what about during the day while you're at work?
Uh, it can go up to the six while I'm at work
Okay.
because, especially if I have to stand more.
Right.
Yeah.
Okay. Do you have any opportunities at work to kind of sit down or to ice it?
Um, I'm not able to ice it at
Okay.
work. Um, and I mean, I sit down when I can, but it's a lot of up, down normally.
Okay. Does that kind of standing up motion, does that aggravate it at all?
It's not really a standing up. It's more whenever I leave weight on it for
Okay.
a
Okay.
little bit.
Okay. And then how about in the evening when you get home from work? How does your leg feel then?
Pretty bad because the walk from my car to my house kind of hurts.
Okay.
So,
To get into your house, do you have to go up any stairs or anything?
no.
Okay. Um, and then that pain in the evening that you have, do you have to take any medication for it?
No, not, I mean, when it first happened, I
Okay.
just took like ibuprofen, but not
Okay.
anymore.
Does it stop you from sleeping at all during the night?
No.
No? Okay, good. So next, I want to go over the medical history form that you filled out. Thank you very, very much for filling that out. Um, it can kind of seem random, the questions that we ask, but they're all very, very important to kind of make sure that we're treating you the best we can, right? Um, did you have any questions with this form?
No.
No? Okay, good. Is there anything on here particularly that you want me to know about?
Not particularly.
Okay. I see here that you put that you have some anxiety. Do you receive any treatment for that?
No. I used to go to counseling like a while ago,
Okay.
but not anymore.
What can I do to kind of help your anxiety during treatment?
Well, I'm probably most scared about it hurting.
Okay.
I had a friend who went to physical therapy. She said it was very painful and she didn't really feel like it did anything. So I'm scared of that.
Okay. Yeah,
Yeah.
totally understandable. Um, I think as long as you and I kind of communicate and you tell me when it does start to get painful, we can try to eliminate that as much as we can,
Okay.
right?
Yeah.
Um, so what I see here that you have the stiffness that you mentioned. You said that lasts about an hour or so.
Yeah.
Okay. Okay. Um, and you said you're not taking any medication, correct?
No, not right now.
Okay. When you went to the doctor to get this referral, did he look at your leg at all?
Yeah, he examined it and then he had me do an MRI.
Okay.
So he said that I have a grade 2 hamstring strain.
Okay. Did he explain that to you, or
Not really. He
you?
just said I needed physical therapy.
Okay. So a grade 2 hamstring strain, um, it means that there was the muscle was injured, obviously, right, with the
Mm-hmm.
pain, but there was no rupture, right? The muscle's not torn apart or anything.
Okay, well, that's good.
Yeah, yeah. Um, it does take about 3 months to heal. You
Okay.
said that you were 4 weeks out.
Yeah.
Um, so I think with good physical therapy, we can get you back in about 2 months, back to 100%, dancing, doing everything you need to do.
Okay.
Okay?
Yeah.
So hopefully that'll kind of alleviate some of your worries,
Mhm.
right? Um, so what kind of treatment or what kind of therapy do you think would help your leg the most?
Well, my friend who had PT, she said the only thing she really liked about it was that she would get like a massage
Okay.
sometimes, and I don't know. I feel like that could help.
Okay.
I don't know.
Yeah, we can definitely work some soft tissue into the treatment plan. That's definitely appropriate.
Okay.
So I see that you came in on crutches. Did your
Yeah.
doctor give you those crutches?
Yeah. I don't think he wanted me to be on them for this long. He just said like maybe the first couple weeks.
Right.
But I'm scared I'm gonna fall, and I mean it kind of hurts to walk a while, and it can help me walk
Right.
longer distances.
Okay. Okay.
So
Um, so have you tried to walk without the crutches?
not maybe like across the living room
Okay.
or in the kitchen, but if I leave my house, I always happen.
Right. Yeah. Um, does your leg pain increase, decrease when you try to walk and weight bear?
Without the crutches, it hurts.
Okay.
It feels better with the crutches because I don't really have to.
Okay. Have you ever had leg pain like this in the past?
No, I whenever I was a cheerleader back in high school, I hurt my hip,
Okay.
and but it was completely different. It
Okay.
wasn't like this at all.
You don't think they're related?
No, I haven't felt hip pain in like a couple years. So.
Okay. Well, that's good. So we talked a little bit about your limitations at work.
Yes.
What other activities are hard for you to do?
Well, I just started running, and I'm not able to do that at all anymore. Obviously, because I can't run with crutches.
Right.
And like I said, my dog, I can't really play with him as much. So we usually play tug of war and I don't know, run around and stuff. And yeah, can't really do that. I used to go out with my friends every weekend, and now I don't because I don't want to bring the crutches. And if somebody bumps into me, and
Right.
what if I make it worse?
Yeah.
So
That can definitely. It's hard to dance with crutches
yeah.
when you're dancing around squeeze box. Um, so what are your goals of therapy? Like, what do you want to get out of therapy?
I have to get back to work
Right.
because I have bills to pay, but and then go out with my friends. Really,
Okay. Yeah, I think those are
all I
both
really
both
want.
definitely really good goals, really important goals, and I think they're definitely achievable goals, right? Getting you kind of off the crutches, get you being able to put weight through that leg, and get you back dancing, get you being able to play with your dog,
Yeah.
and being able to go out with your friends and enjoy yourself, right? Um, so at the end of the session today, I'm going to give you some exercises to do at home. So I can print you out pictures and videos. I can explain them to you. We can do a couple reps here. What would work best for you?
Probably doing it. If you can show me how to do it.
Yeah, of course.
Since I dance, I can probably.
Perfect. Perfect. Okay. Well, next we're going to move out, or we're going to move out of the talking part, right? Move into the physical exam.
Okay.
Do you have any questions before we leave this part?
No, I don't
No.
think so.
Alrighty. Well then, here we go.